Back in the zone, a major new study published in JAMA Internal Medicine reveals a sharp decline in mental health among mothers across the U.S. in 2016. Nearly 40% of moms rated their mental health excellent. By 2023, that number dropped to just over 25%. The findings raising concerns about how our support systems serve modern parents, especially single mothers and those with fewer resources. Joining us to unpack the study, what it means for families, is Columbia psychiatrist and mental health expert, Dr. Meena Marham. Dr. Meena, good to see you.
Great to see you, Oma. Thank you for having me.
This is concerning for sure, but I think any mom will tell you we're not surprised by this.
Yeah, absolutely. Sometimes the data like this, that's not surprising, but what does help us see is put numbers to the experience. I see this from patients every day. I was just doing a consult on a new mom this morning, and this large data set of 200,000 mothers over a long period of time shines a light on this. You know, there was a large Surgeon General report just a year ago that said parents are under pressure. And the more that we're seeing the numbers come out, the more that we're able to advocate for new moms, as well as moms who are struggling, single mothers with less resources, to say they need much more support, and the data supports that.
So you see the numbers from 2016, and then you see what they came up with more recently. What has changed overall? What are you hearing, and what does the study find?
Yeah, there's been a lot that's been changing. The study doesn't exactly account for all the factors that are causing this. It was more so descriptive. It looked at essentially the physical health as well as mental health of mothers, and it asked them, this is essentially a big question to all moms, saying, how are you doing? How are you feeling physically, and how are you feeling mentally? And what we're seeing here is that we're essentially asking moms to do more with less. One of the things that were key in the study here is looked at moms who are using public insurance, for example, those who are using Medicaid, and are saying, you know what, those who have less resources are really struggling even more. And the more that we're putting this pressure on the moms and not putting the proper support, things like Medicaid cuts that are happening now, we're going to see more of this unless we pivot and really show a different level of support to these moms.
So we know there needs to be policy changes. We know there needs to be overall changes in the way things are done. What's the biggest takeaway that not just moms, but the public should take away from this?
Yeah, the biggest takeaway here is that, you know, that old adage of it takes a village to raise a child is increasingly true for us here, that we see moms being isolated and being expected to carry a large burden. This is a big call to action for us as communities, as friends, as folks who are able to sort of wrap around and say all of these environmental factors impact the entire family, not just the mom herself, but even a newborn child and a young child in their developmental period. So this is a big call to action for us to say we can really come around folks, not just from a policy standpoint, but every single one of us has an impact to support new mothers in particular.
And we know that village has been shrinking over the years, and hopefully we can build that back up. And hopefully this study really gives folks that red flag that we need to be paying attention to. Dr. Meena, thank you so much.
Thank you for having me. Absolutely.
All right, we're going to take a quick break and be right back in the DMV zone.